We're currently 5th semester ADN students at HGTC. We've had many semesters of clinical experience in various settings such as med-surg, nursing homes, rehab facilities, PCUs, nursery, postpartum, and orthopedic units. Our professional goals are to pass NCLEX on the first try, become full-time nurses, and then continue our education.
For safety, we covered the national patient safety goals that were enacted January 1st, 2015. In clinical and in class, we covered insulin worksheets, ranging from insulin administration, mixing insulins, insulin timetables, and sliding scale examples. We covered diabetes mellitus flow charts, blood donor recipient charts, IV solutions, and nursing considerations when administering IV solutions. We covered hand washing techniques and the proper use of personal protective equipment.
For clinical decision making, we did head-to-toe assessments, which is one of the most important steps in the nursing process. It helped to make the nursing diagnoses for each patient and formulate a plan of care. We also went over the NCLEX test plan, which outlines content that will be tested on, and it guides the item writing process. We also went over Maslow's hierarchy of needs, which is a model of the basic human needs and how they build upon one another to achieve physical, social, and spiritual health and well-being. And we also went over medication administration, and whenever we're doing that, we need to remember the 6 rights, which are the right patient, right drug, right dose, right time, right route, and right documentation.
Okay, and teamwork and collaboration includes giving a report at the end of shift and receiving report prior to patient care. I also completed several group presentations, including arts and crafts at Conway Manor, stress management and bed compliance at Lighthouse, as well as hand washing and CAD presentation.
For professional behavior, we learned about the student learning outcomes, the Nurse Practice Act, which shows us what we can and what we cannot do as nurses. In addition, we learned about the use of social media, which is what you can or cannot post, like on Facebook and places like that. We also learned about ethical dilemma research involving patients in regard to care when it comes to ethical decision making. And we also learned about resume building and mock interviews.
For patient-centered care, we did an ethics, so we learned about different cultures and what their beliefs are, so that we're able to provide them with the best quality of care. We learned we did our skills check off inside of our clinicals, so that way we made sure that each patient was getting the individual care that they needed, as well as the safety aspect of it. And we made sure that we learned all of our ABCs in our practice, so that way we were able to provide the best care and patient-centered care for the patient.
In conclusion, we've learned more than we thought possible in the past 2 years. ABCs are always first. Nobody is alike, and so critical thinking is a must because all patients are different. Collaborative care helps ensure safety, so make sure you correlate with those that are working with your patient. We're a patient's advocate, and they're not just a person or a diagnosis, they're the whole spectrum that you've got to look at, psychosocial, everything. And then last but not least, nursing is a profession, and we have a standard to uphold.